Silber, Dr. Sherman Silber, Infertility Center of St. Louis, and I'm here with the most amazing fertility story ever. This is Amy Tucker. I've known her since she was a little 19-year-old girl who was facing death with Hodgkin's disease, a terribly difficult case. And she's got 2 children from her frozen ovary that we froze before she underwent her chemo and bone marrow transplant that sterilized her, and she's now pregnant with twins. She's going to wind up having 4 children from this ovary we froze before she had this life-threatening cancer and was treated for it. Here's Amy.
Yeah, hi. So yeah, it's been quite the experience that we've had. I wouldn't have guessed when I was 19 years old. I wasn't really thinking about family, and I remember being approached about freezing the ovarian tissue by a nurse, and I was in the right place at the right time. And so we were able to freeze the tissue, and luckily, because after the bone marrow transplant, I wasn't able to conceive. I went into menopause.
You were completely in menopause.
Completely in menopause, yeah, with the remaining ovary.
Yeah.
So.
And the only reason we leave the one ovary in and take an ovary out is so we'll have a place to transplant the frozen ovary.
Yes.
It's a good location.
Yes.
So that's why we leave one ovary in.
Right.
But we knew that ovary was going to be destroyed otherwise.
Yes. Yes. And it was, I mean, I think that the part of the overwhelming thing was just that it was experimental when we did it.
Totally.
It was like, works in sheeps and rats. Why not humans? Give it a whirl. What else are we going to do?
And it was really experimental. You know, we interviewed one wonderful patient. She remembers it so differently 20 years ago, and I'm sure you remember I was saying, hey, this is just experimental. I mean, there's nothing else we can do. I don't know if it'll work. I don't know if we have to worry about transplanting back cancer cells. I don't know if we'll be able to culture your follicles. And it turned out that you don't have to worry about transplanting back the cancer cells. We don't have to try to culture the follicles. The transplant works. And so now we accept this as pretty routine. But when you went through this...
Yeah, and you know, in the moment, I didn't even have time to think about it. It was just like, I think a lot of times when you're in the heat of the moment of like cancer and you're facing like treatment and you need to start treatment right away, you don't have time to really think about, well, later down in life, when I survive this cancer, what am I going to do about, you know, family? And so none of that, and being in college, I didn't think about that at all, not in a serious relationship. So I think that like, for me, there was no thought. We just did it because we're like, hey, it's out there, and what's it going to hurt? Because I remember saying, take both of them. If the one's not going to work, you're like, no, we should keep the one, and it might work. You know, you never know. So, you know, I think it's just amazing how it all came together, and you know,
it's amazing because we didn't know when Amy was 19 and I talked to her. I didn't even know you were eventually going to be an oncology, pediatric oncology nurse. So
yeah.
I didn't know what your future was, but there's nothing else we could possibly do to save your fertility. Mm-hmm. So give it a try and see what.
Yes.
See if it's going to work out.
Yes. And I thought I really didn't have anything to lose. So at that point, and obviously I gained a whole lot.
and now you're going to have 4 children from this 19-year-old ovary.
Yes, yes.
And how old are you now?
I'm 39 right now.
Oh my gosh, so
yes.
you would have been in trouble just because of age maybe.
Yeah.
How are you doing? Are you happy to be on Facebook Live?
Amy, have you had to have more follow-up treatment or infertility, any kind of IVF process, or you've been able to get pregnant naturally?
All of them have been naturally. So, which is even more overwhelming with the twins. So yeah, like even like following counts, you know, you're looking at the counts thinking that the ovary is at the end of its, you know, life cycle. And I mean, we were able to get pregnant with her, and we really thought she was probably like the last remaining egg, and then like, wow, we're pregnant again with twins, you know?
It's amazing because when they hear you have twins, they might think we did IVF and put back 2 embryos.
Yes.
No, this was just natural twinning.
Yes, and twins definitely run on my mom's side, so it's not a natural for that. So.
And you know, it's very exciting in other ways because it took a while for Amy to get pregnant.
Yes.
And you
Well,
were-
with Grant, is pretty quickly.
Yeah.
Like, we put the ovary in January. It worked, started functioning as an ovary in June, and we were pregnant by September. So
Yeah,
he was
that was
fairly
quick.
quick. But then the second tissue, we weren't able to get pregnant off at all. I mean, and it was, it was kind of disheartening because,
we
him,
were
it was
worried
so,
about it, that
yes.
might have been the end.
Yes, yeah. And so we were like, then we put the third tissue in, and even that was in a while before we got pregnant with her. So,
Right.
it's like obviously a big span between the first two.
And we really didn't. We were happy with. We were overwhelmed with 2.
Yes.
Look at how beautiful
Yes.
she is. And you never achieve. This is
yes.
a shock.
Yes.
Having 3 and 4.
Yes, it is definitely still a shock.
But I think a point that we'd make about this is with the frozen ovary transplant. Usually IVF is not a good idea. You don't really get very many eggs with IVF, and if you are just patient, what we're finding out, and Amy's a perfect example, if you're just patient, sooner or later you get pregnant. And there's a reason she has twins, because, after ovary transplant, you don't have that many eggs, but they're young eggs.
Mm-hmm.
And so your FSH is elevated, and you're more likely to have twins just because you have good eggs but a low number of eggs.
Mm-hmm. Yeah.
So, go ahead, yeah.
I was just going to say, what would you suggest to someone considering getting their ovaries frozen or their eggs frozen that's going through cancer treatment at the same time? That's a lot to take in.
It is. But I think that right now, I mean, it's hard at that moment because you're thinking about treatment. And I think that in oncology right now, we're starting to do a little bit better at talking about infertility. I think it was one of those things like if you're a boy, you got referred right away, sperm banking, easy collection, no thought process. Where with women, it's not as easy. I think the challenge comes that like you're facing all these costs when it comes to regular chemo treatment and like the medicines, etc. That when you're also coupling in, well, who's going to pay for the storage fees? Things aren't covered by insurance always. And so I think that's where people struggle with, and so it's harder to like convince people that like, there will be a future, hopefully after the cancer treatment. And I mean, obviously this is living proof that, sometimes you just have to take a gamble, but every circumstance is very different. So I think it's challenging. I wish there was, and I know you've been working on like trying to get insurance coverage, for everything.
Amy came to the White House to lobby for insurance companies to pay for this. And it isn't really very expensive. I mean, they pay, maybe hundreds of thousands of dollars for your cancer treatment. This isn't expensive. On the other hand, if a young girl, and I say girl, 19 years old, is facing cancer and might have a $6,000 hospital bill that is uncovered, she has to think about it because she doesn't have any money. So I've said in our infertility meetings that it's criminal, absolutely criminal, and I use that word, that insurance companies don't pay for us to freeze the ovary tissue on cancer patients if you're particularly covered with good insurance. And it's also criminal that our professional society, ASRM, still calls this experimental, which gives the insurance companies an excuse for not paying. This is obviously not experimental anymore. It might have been experimental 21 years ago, but it isn't now.
Right, correct. I mean, there's been a lot of success, and that has happened since then.
Yeah.
So yes, but that is definitely the challenge.
Can this treatment be applied to anyone dealing with cancer, any types of cancer, or are there restrictions?
It's interesting. It used to be thought that this is not good for leukemia, because leukemia patients, and Amy had Hodgkin's, and you've already seen some of our leukemia patients that we've done. Leukemia patients, it was thought, would have leukemic cells in their ovary tissue that would be transplanted back. But then studies in Denmark demonstrated that the ovarian cortex, where all the eggs are located, is tough tissue where cancer cells don't want to go, and particularly if a leukemic patient has already gone through a round of chemo, and so she still has cancer in her bone marrow, but she's in remission, then there was no cancer in the ovaries. So we've already had 3 leukemia patients successful transplanting ovary tissue back, and there's no, and the oncologists tell us, and we've already observed, there's no chance of transplanting cancer cells back. So otherwise, we've always felt this was good for any form of cancer. We were worried about leukemia, but now it seems like it's good for leukemia too, as long as you take out the ovary after they're in their first remission.
Okay. Latoya would like to know, how are patients that travel from out of state handled?
Well, we have so many patients that come from out of state, and it really isn't a problem. I mean, you were out of the hospital the same day, I think.
We stayed overnight.
You stayed overnight.
Yep.
So it was just one day, and frankly, nowadays, we just let them go right home the same day. We can inject into the operative site an anesthetic that lasts 3 days. So they have, and by then they're pretty well on the road to healing. So they really don't have much pain. They can just go home and walk away the same day. So out of town is not a problem. You can come here, stay at a motel overnight, and then leave the next day.
Marciella would like to know, what is the best procedure for older women in their 40s?
Okay, so this is an interesting question. You know, older women in their 40s. This is what we're dealing with in infertility every day. Now, Amy is 39, but she's got a, 19-year-old, well, it's a little older now, but a 19-year-old ovary she's getting pregnant from. So, so age is not a problem for the woman to get pregnant and carry a baby. The only problem is the age of the eggs makes them less fertile. So we feel, and it's not really related to Amy, but we feel a protocol called mini IVF is perfect, in which we don't overstimulate the ovaries. We get a few good embryos, we freeze them, and the next month we do it again. And it's so easy on the patient because it's not a huge amount of medication, and we get better quality eggs that way. So we actually have good results with women over 40, but it does involve the mini IVF protocol and probably multiple cycles to store up enough embryos to statistically put them into about a 50% category for having a baby. So we're doing really well with women 40 and older, but that would be the protocol we would use.
Okay. Amy, have you experienced any complications or any concerns with your pregnancies?
Well, with just typical, like you would with any normal pregnancy. With Grant, I had preeclampsia, so we induced early at 37 weeks, and then I did end up with gestational diabetes with Faith, and so we just got induced at 37 weeks and a day. But both deliveries were fine, and both were healthy.
That's wonderful. Dr. Silber, what would you tell someone considering IUI over IVF?
So the question is IUI, intrauterine insemination. You know, I've been around a long time. I am the reason I'm answering this question this way is I am the oldest living practicing infertility doctor in the world, and nobody older than me. But so I was around long before this, and I can tell you what IUI is ridiculous. It's worthless, but I can tell you what happened when IVF first was developed in England and Australia. In America, we felt kind of inadequate because how does a fertility doctor, even a microsurgery expert, start doing IVF? You need cell culture people, and everybody felt inadequate. So what happened in 1982, that was 4 years after Louise Brown IVF, was a presentation was made by a University of Southern California doctor that seemed to save the day for doctors that really didn't have that technology, and called IUI. So he said, you just take the semen sample, anybody can wash it in a centrifuge, just like you do a just like you do a urinalysis, and then you can take that washed sperm and put it in the uterus. We didn't even have normal catheters then. It was infant feeding tubes. Infant feeding tubes is all we had. So put it in, and everybody was excited. It was a big American Fertility Society meeting. There were many thousands of doctors there. Everybody's excited. We don't have to know how to do IVF. We can just do IUI, and it's just as good. And there were ridiculous papers. I think they were almost fraudulent papers reporting 50% pregnancy rates with IUI, and that's just not true. So when we studied it carefully, because I was doing IUI, I was doing ovarian hyperstimulation going way back to 1975. And if you do ovarian stimulation and have the couples just do timed intercourse. The pregnancy rate is absolutely as good as doing ovarian stimulation and IUI. Now, IUI without ovarian stimulation doesn't work at all. And we're talking about a pregnancy rate of about 6 or 8%. So as the woman's age are getting older, she's getting older, her chances are getting worse the more she delays, and sometimes they go through 6 IUIs or 12 IUIs lasting 2 years while their eggs are getting older with a very low yield. So if you want to do a few IUIs, go ahead, but it's really silly. IVF will have, in a woman under age 36, will have a 60% pregnancy rate for every transfer, and most women should get pregnant with IVF, but not if they keep on doing an IUI for years until they get too old. So, I go back so far that I know that putting the wash sperm in the uterus is absolutely no better than intercourse.
Okay. Chin would like to know, she is 44 years old and had a baby naturally last May. Congratulations. And she's been trying since August but is not pregnant. With mini IVF, would she need 2 IVF cycles or just 1? And she says she's concerned about the cost.
Yeah, well, okay, so we try to keep the cost down because I think for a 44-year-old, and by the way, I'm very thrilled that she got pregnant naturally and had a baby, and she's very, very fortunate. And I understand her wanting to have a second baby. And I think the prognosis is reasonably good because of her history. But I would want to do mini IVF and collect embryos until she says stop, whether it's for financial or emotional reasons, and then we transfer the embryos. It's important that we have a protocol that's less expensive and that is less troublesome than regular IVF protocols. Otherwise, she'll just give up after 1 cycle, and she's better off doing several cycles.
Okay. Amy, could you talk a little bit about, do you do any kind of outreach or talk to anybody else about your experience, anyone going through cancer or anything like that, or what would you encourage someone to know who's been through cancer or is going through?
Sure. I have reached out to several of our patients. Usually I talk to the physicians first to say, because some families just aren't in a good place, and so I've reached out to some families that way. We've done some stuff with the infertility society and things like that as well. I just think it's the more we can get the word out about this option, because a lot of people, like I say, overlook it just in with everything going on at the time.
Yeah, particularly a young person that's facing cancer it is really being hit with a tremendous challenge, and it's hard necessarily to think ahead. But I've talked to young women that they know they're going to survive the cancer because young people always feel immortal.
Yes.
And you were immortal.
Right.
but they really are upset when they think about it that they won't be able to have children.
Right.
So we have to talk about it.
Yes,
more.
we have. I do. I think that as a society, I think it's becoming a little bit more commonplace to talk about infertility, whether it be caused by cancer or for other reasons. So I think that as society, doesn't view it so negatively and such a hush thing. It is a disease just like anything else.
Yeah.
So I think that will also help,
Right.
as well.
And then we really have to get these insurance companies to pay for it. It's not expensive. That's the amazing thing about it. But as long as our society, SRM, calls this experimental, the insurance companies have an excuse for not covering it. But it really is an experimental. Over 70% of our patients who were sterilized by their cancer treatment get pregnant with 1, 2, or 3 babies, and Amy is a perfect example. It really is not experimental anymore, even though it's labeled as experimental. It should be covered. I mean, what is a young girl going to do? Okay, we got a $6,000 or $8,000 hospital bill. Should we really do this? I don't know. I'm worried about my cancer. So if it's at least covered by insurance, it'll make it easier.
Yeah, even if it was covered by more foundations, I think as well. I mean, you've got the Lance Armstrong Foundation, things like that. Even if more of those would cover it, help with some kind of financial assistance.
Even
I think that would would help, because I think that it is a lot, and we're seeing a lot more patients survive cancer, right? Because we've perfected a lot of treatment, and so but then the problem is 10, 20 years down the line, these patients are like, well, oh, what do you mean I have this? I can't have kids. I can't do this. All these things that at the moment they weren't thinking about. So I think that we just need to be better about getting the word out. And again, it's just about getting the resources to help those families that can't.
Gotta get the word out.
Yeah.
She went to the White House and lobbied for this, and they were all impressed, but it didn't seem to do any good.
Right.
Do you know, in Amy's case, is she the only one so
What's that?
far? Is she the only one so far to have 4 pregnancies?
Oh yeah, 4 is really phenomenal to have 4 babies, and we're happy if they have 1 or 2. But in time, I think most of them will have several babies.
Right. Well, and whenever we had done ours, right, that was like when the freezing technique wasn't as good, so we lost a large number of eggs.
You
so
actually had a
it's
terrible
pretty-
freezing technique, and whatever it was, 1997. Right?
Yeah, 98. Yeah.
98.
Mhm.
I mean, we're so much better at it now.
Yeah, so I think that's the other amazing thing to me is that even after, like, losing probably half the amount of eggs, like,
Right.
still to have the 4 children I'm going to have, like, it's a little overwhelming.
Yeah, so it's very robust because we were really crude in the days when we did her freezing, and so the ovarian tissue really is robust in terms of freezing. It can
Yes.
tolerate all kinds of abuse.
Right.
How should couples evaluate IVF or infertility doctors?
Okay. How do they decide where to go? Well, the best thing is do a consult, and of course our consults are all free because you shouldn't feel a financial impediment. And then you just talk to them, and then you have to make an emotional judgment. This is becoming a huge commercial thing. Now, if I remember correctly, I think you paid nothing. Is that right?
Correct.
Yeah, that's what I
Correct,
thought.
yeah.
So because we really wanted to make this thing work, but there are a huge number of infertility programs that are basically just commercial. And I think you don't want to go to one of those commercially oriented places. You want to go to some place where there's a certain amount of character. And you'll be able to evaluate that best just by going for a consultation, I think. And you'll make a judgment about it that way. You got to go with your feelings.
How did you two come across each other?
You tell me. I don't remember.
Well, and I wish what I don't like in life is that I cannot remember the nurse who made it happen. To be honest, we walked in. We were going to sign consents for my bone marrow transplant, and I remember the physician, but I do not remember his nurse practitioner, who just so happened the day before to go to one of your talks.
Oh, okay.
So it wasn't even as much. I love all the science and everything, but God put you in the right place at the right time. I mean, there's no, because if I had come the day before, she wouldn't have been there. She wouldn't have been to the talk. I didn't go out on my own seeking anything because to me, I was in college. I didn't want to miss school, so just get me this cancer treatment and get me back on the road. Like,
Cure me of my cancer and let's get
yeah.
on with it.
And so because of her, because she had went to this talk, and then I looked at my parents, and again, I was 18, whatever, and so. We were like, okay, so we called them up, and like the next, I think that we had an appointment within like a day or two, and I remember like we had it set up within like a week later. We met you, basically did the surgery, and then the day after the surgery, we drove up to, because I went to school up at Truman State, but I got treatments down in Columbia, because that was the nearest center. And I remember driving up in the car the day after surgery so that I could get chemo treatment before that was for prep for stem cell collection for my auto transplant. So yeah, it was all like, again, right place, right time.
So you drove the day after surgery.
Yes, so we drove the day after surgery.
So this isn't
Yes.
going to delay one's cancer.
Right, right.
Just get it done, and it won't delay cancer. That's
Yes.
the beauty of it.
Yes.
Whereas if you try to go for stimulating to freeze eggs, it can delay cancer treatment, and oncologists don't like to see that happen for a good reason. And so that's why this is the appropriate approach. Now, egg freezing is not considered experimental, but it should be because it's not popular with cancer patients because the oncologists don't want to delay things. And then you really need 3 cycles if you're going to feel comfortable that you have a good chance. And so it would delay things possibly 9 months even, which is ridiculous. But with this, you just got your over out and
then
got your treatment.
Got my treatment.
Jamie would like to know, how long does the IVF process typically take from testing to egg retrieval?
Well, normally, I mean, you can make it very long if you do a lot of unnecessary testing, but frankly, we get all the information we need from the history, the age, the sperm count, and the ultrasound. We do a detailed ultrasound to count antral follicles. So we have everything we need with that. We don't do a lot of laborious, extra expensive testing, but those are so-called add-ons that just increase the cost of infertility treatment dramatically. So really, from the time we start them on stimulation to the time we do the retrieval is only about a month. It doesn't have to be any more than a month. But if we're doing it for cancer, one cycle is really not enough to freeze those eggs and be comfortable. And so a month delay the oncologists don't like. But if you're talking about a 3 or 4 month delay, well, they just won't tolerate that.
Okay. How long should a couple try to conceive before seeking help?
Okay, the classic answer about how long they try to conceive before seeking help is 1 year. But that changes if they're older. If they're over 35 and the eggs are having a 10% decline in fertility, we wrote this up in a paper a couple of months ago, the eggs are having a 10% decline after age 35 in their fertility, well then you really don't want to wait very long. So the general recommendation is 6 months. But if it's a young woman, then you probably can wait a year. But if the ultrasound shows that she has very few eggs, then you just don't want to wait at all. You don't want to rush into it. And we can tell very accurately with our antral follicle counts, extremely accurately, what her ovarian reserve is, how many eggs she has, and whether she should hurry up with treatment.
Okay, and I know this is something you typically don't like to talk about, but could you talk a little bit about the price range for an IVF treatment, or what that range may be? And I know it depends on a case-by-case basis.
Yeah, well, price is and cost is very important to people. And this is infertility is really quite an epidemic around the world, and it tends to be because people are putting off childbearing, and it's a different society we live in, and so their eggs are older. So it's important. By the time you add up ultrasound and laboratory and physician's fees and hospital fees and drugs, which are very expensive, I think in most centers it would be about $15,000 for just one cycle. We've managed to reduce that with our mini IVF protocol to $10,000, which is still a heck of a lot of money. But I think around the country, there are programs that have a big brand name where you could easily pay $25,000 for one cycle, which is just outrageous. But by and large, people think that $15,000 is about what the average cost is per cycle. But if someone needs 3 or 4 cycles, it could be $50,000 or $60,000. So the mini IVF, which we need particularly for older women, and we might need to do 2 or 3 cycles, we need to keep that as inexpensive as possible. So for our mini IVF, it'd be, by adding up everything, the total thing, it'd be $10,000 for the first cycle and $7,500 for subsequent cycles. So it's a lot of money, but it's not the $15,000 per cycle that is the average.
Okay. What's something that couples could consider other than IVF that works to get pregnant?
Everybody really wants to know what else is available, simple treatments, and they might wind up spending $5,000 or $10,000 on IUIs, which is a waste of money, and they'll usually go to the health food store and buy all kinds of dietary supplements, because if something costs $39.95 or $59.95, they figure, let's try it. But none of them really are effective, and some of them can actually be harmful because they might put estrogen or testosterone in them just to get some kind of an impact or an effect. So it's really a problem. Now, the best advice I can give, though, if you're young and you really don't want to go into IVF and you can't even afford IVF right now, is to avoid the advice that you're getting everywhere about timing intercourse. These ovulation kits are not very accurate, and very frequently you'll wind up having your intercourse after you've ovulated, and the egg is no good 8 hours after it's ovulated. You always want sperm in the reproductive tract of the female, and the sperm will last and be good for 2 or 3 days. So I tell people, don't try to time when you have sex. It does no good. We told you that many times.
Yes.
Just try to have a happy, healthy marital sex life, and that usually turns out to be 2 or 3 times a week on average, unless you're too busy in life. And at 2 or 3 times a week means there will always be viable sperm in the tract for whenever you ovulate. So I think that's the most important practical advice that I can give, short of technical treatment, and that's what we did with Amy.
Yeah.
I said, you got a good ovary, a young ovary, and don't do any timing or ovulation timing or induction. Just have intercourse.
Yeah,
and have a happy
that's all we did.
life.
Yeah. I mean, I never, and I think that to me too, that just added like an additional stress. And I think that with everyone in general, we all know that stress affects the body,
Yeah, right.
even when you're trying to get pregnant. You
Right.
know, so I think that like a lot of times when you focus on like timing your ovulation, you're so focused on that like adds another element of stress because you're not getting pregnant. And you're like, I should because I should do it right now. Like you know.
And that stress, it can prevent you from ovulating because it affects your hypothalamus, the primitive area of your brain that controls the pituitary gland. So, I mean, the stress associated with
Yes.
trying to time your intercourse can actually prevent you from ovulating.
Right.
Amy, do you have names for your twins?
No, we are actually going to, with the first 2 pregnancies, we did not find out we were having, but with the shock of everything, we are this time going to find out ahead of time, because we're also not very good at picking up names, so we're going to find out. So hopefully in the next couple weeks we'll know what we're having, and the names will be picked out.
Okay, and what's your due date?
My due date is January 2nd, but we plan to probably take the babies early in December. So,
Yeah, but with a twin pregnancy, you generally want to go earlier.
yeah.
Is there anything else the two of you would like to share about this incredible journey? I mean, it's truly incredible.
Yeah, I think that I'm just overwhelmed at like everything that has really happened in my life in general. I mean, all the blessings I've been given. I mean, from surviving the Hodgkin's, the relapses, the phase 2 chemo that I did, like all these things and then to still have the ability to like, because we froze my tissue, to then also have a family of my own that I didn't dream possible at one point in life is just, I mean, it's still overwhelming. There are no words, just the happiness that
Well, there's no question that, in my view, that God had a role to play here. I mean, she had relapses, and they really thought she was going to die.
Yeah.
And she's a cure, which is amazing, and she's actually going to have 4, and it may not only be 4. You might
4 will be good.
After you have these babies, you could get pregnant again. You better watch out.
Yeah, exactly. 4 will be good.
It's really exciting.
Yes.
Amy was just a little girl, 19 years old. Call you a girl then. That
Right.
That would be, rude to call you a girl. So, all right. So I just wanted to let you know that you can call anytime our office, and no fee particular for anyone. But if you're a cancer patient, don't delay. And we won't even charge you anything. Unfortunately, the hospital does charge now, but it's not too bad. It's a small amount, but we won't charge. We just want to make sure that you get your fertility preserved and don't lose it because of the cancer. Because most likely, and this is good news, you will be cured of your cancer most likely. This is the modern era. So, and also you can just go to our website, infertile.com, or you can call our office. And I'm really not, like hawking for business. We're not that kind of a center, but we just want to make sure people get the attention they need.